Number 31. You see the increase in the echogenicity of the renal medulla. The pyramids are normal. Increase in the echogenicity of the renal medulla and pyramids are normal and hypoechoic to the cortex. The appearance is typical of the medullary nephrocalcinosis. Medullary nephrocalcinosis may have many causes. Image number 32. The features of the CKD, chronic kidney disease, usually mode finding of the long-standing, the severe CKD, chronic kidney disease specialist stage 5. Reduce in the renal cortex at first one, reduce in the renal cortex, a more label or the decrease in the size less than 6 mm. Reduce in the renal size. Reduce in the renal size, increase in the renal cortex echogenicity. The renal cortex increase of the echogenicity. Poor visible of the renal pyramids, cannot be see the renal pyramids, poor appearance. Poor visible of the renal pyramids and the renal sinuses. Margin irreliable. The margin of the renal, it's irreliable, there is not rounded shape. A pylori calcification, the feature of the internal of calcification inside of this kidney, and the cyst. See also the acquired the cystic inside of this kidney, the feature of the chronic kidney disease. Image number 33. Define this position. The position of the sagittal view. Other this, the chronic view for the C, the spine vertebra. Image number 34. The feature of the hydrocephalus. Hydrocephalus, the fetus in the third trimester, increase in the third ventricle size. Image number 35. The feature of the increase of the ventriculomegaly size. Image number 36. The fetal in the third trimester, you can see increase in the bladder size. The features of the obstruction, fetal cannot be wasted of the urine. The feature of the posterior urethral valve obstruct. Other one, image number 37, defines the modalities and type of the disorder. The cranial ultrasound. The features of the hemorrhage. Image number 1, the feature of the first stage. The hemorrhage in the first stage, there is not fall of this ventricle. Other one, image number 2, the stage 2. Stage 2, you can see the fluid of the blood inside of the lateral ventricle, but there is not full. Different between the stage 1 and stage 2 and stage 3. Stage 3 can be see all this ventricle obscured by the internal bleeding. Number 3 image, the features of the stage 4. Why is it called stage 4? After the filling of this ventricle, you can see the blood escape into the brain parenchyma. Image number 4, the feature of the ventriculomegaly or the hydrocephalus, increase in the size by the serous fluid inside of this ventricle. Image number 38. The patient suffering on complaint of the vomiting and abdominal pain with the jaundice. The abdominal ultrasound, use a curvilinear ultrasound. You see calcification inside of this is pancreas, the feature of the pancreatitis. Image number 39. The abdominal ultrasound and this liver, you can see increase in the size of the portal vein, the feature of the portal hypertension. Image number 40. High resolution probe used for the discovered. The patient may be suffering from the vomiting, an increase in the WBCs, the feature of the appendicitis more than 6 mm from the normal size. You can detect it by the P mode by using linear ultrasound and apply of Doppler, power Doppler for the C, the feature of the ring fire. The measurement from outer to outer for detective. Image number 41. The wall at first one, the wall defined and heterogeneous heterogeneous of the hypoechoic lesion. Encircling the radial lateral extension tendon slips. Lesion extends into the radial of the digital. No extension of the lesion into the proximal interphalangeal joint. No cystic spaces or the calcification in the lesion. Show the vascularity approximately 15, the size from the 15 for the 12 and 11 millimeter. Extensor of the tendon include of the lateral slips, indicated the flexor tendon, the feature of the Giant cells tumor. Image number 42. The features of the Steiner lesion appearance. The Steiner lesion appearance. A rounded and heterogeneous lesion stops proximal to the metacarpophalangeal joint with no visualization of the ulnar collateral ligament fibrosis. Other one, the passive flexor of the interphalangeal joint of the thumb during dynamic ultrasound of the ulnar collateral ligament allow for the identification of the non-display ulnar collateral ligament tear for the Steiner lesion. Image number 43, elbow scan of the MSK. Posterior long axis view of the elbow. Show of the elbow joint. High frequency linear transducer. The transducer indicate is the position superior and proximal. A large elbow joint effusion is labeled along with the relevant anatomy note. The posterior displacement of pad. The features of the elbow effusion. Image number 44. What is the tendon? It's a feature of the biceps tendon, large tendon, and the hyperechoic. Image number 45. The ultrasound used with the ultrasound of the MSK for detective of the shoulder joint and ligament. You see the multiple echogenic line, the features of the tendon calcification. Image number 46. Patient hypothyroidism and neck extension. Increase in the size of the thyroid and small cystic, and feature of the hypervascularity and hypothyroidism, the feature of the Hashimoto's thyroiditis. Image number 47. What is the view of the echocardial? If you see the 4 or the 5 chamber, the left ventricle and right ventricle, left atrium and right atrium, and the aortic, the feature of the apical 5 chamber. Image number 48. Transrectal ultrasound. You see increase in the size of the prostate. This ultrasound use rectal ultrasound for detective of the prostate, increase in the size and internal calcification, the feature of the PPH, benign prostatic hyperplasia. Image number 49. The one unicornate of the uterus have the one fallopian tube and ovarian. The feature of the unicornate Mullerian anomalous. Last image of the 15. What's about the protocol? The feature of the elastography. Elastography protocol of the ultrasound for detective and differentiation between the solid and the cystic masses is good for the evaluation and differentiation about the masses by using of the pressure. Final exam of the North Star ultrasound. Thank you.